I'd like to think that had we already passed reform here in our state and had been moving forward and national reform had passed, that my mother's end of her life would have been very different.
I believe that healthcare reform has been wonderful for the state of Massachusetts. It has moved us forward in a way that is remarkable.
We weren't sure quite how this was going to work, how well it was going to work.
I became disabled when I was 15.
And be rushed to the hospital feeling like I was going to die because I just couldn't breathe.
I became a cancer doctor with cancer myself.
It's given our residents so much benefit.
I know I wouldn't have the quality of life that I have here if I lived in any other state.
This is the best kind of example of how government could work and should work.
That we're this close on the federal level is breathtaking, and we can't let the opportunity pass away.
I don't think people voted for Scott Brown. I don't think that vote was a vote against health care.
We could not take the next steps that we really need to take here in Massachusetts without national reform.
It would stabilize our healthcare system financially.
National healthcare reform will channel over $200 million into safety net hospitals like the one I work at.
A national tax credit that would help us retain this level of health care for my people is really important to me.
I have to provide for my kids. You know, they still, especially with my oldest son being partial disabled.
It'll also give some tools that we need to do a better job in managing costs.
And it empowers us to have a vision of what we need to build over a period of time in order to ensure access, improvement, and reduction in cost.
I personally think it's a human right for everyone to have good health care and access to health insurance.
About 20,000 people a year die needlessly because they didn't have access to the health system.
And I've got a granddaughter, you know, so I want to make sure that she doesn't have to go through some of the obstacles later in her life that so many of us have gone through.
We want national health care reform.
This is a right, this is not a privilege.
Tens of millions of people are not insured in this country. We can do better.
It's your health. It shouldn't be optional.
I voted for Scott Brown. I support national health reform.
Physicians 10 years from now may never have to say what I have to say, that we have seen people die, go to institutions, lose their function, their ability to live independently because they were unable to receive treatment that we knew how to give them.